For more than 9 years, war has devastated Syria and its people. More than 6 million people have been internally displaced due to the conflict. Another 5.3 million fled the country entirely. Among these millions of people whose lives have been uprooted are many doctors, nurses, and others working to train new healthcare workers. Even those who have not been displaced and continue to provide healthcare face a harsh reality. Systemic attacks on healthcare facilities and personnel are a well-documented and regular part of the conflict. It is in this context that many young Syrians choose to pursue education in healthcare fields. A new HHI study tells the story of adversity faced by those who, in spite of the risks, aspire to work in healthcare and help their communities when humanitarian need is the greatest. Before the war, doctors were viewed with prestige, and high-achieving Syrian students would aspire to attend the nation's reputable medical schools. With a relatively advanced healthcare system, training for nurses and other roles was also widely available. But 9 years of conflict has disrupted the network of doctors, educators, schools, hospitals, health workers, and students who once created a strong educational infrastructure. For students, getting to class often means navigating a war zone and risking their own safety. This, in addition to financial insecurity and the stress of being a student, takes a great mental toll. Additionally, students in opposition-held areas must sometimes attend non-accredited universities where the degree they earn may not mean anything once the dust settles.
You're not sure that your degree itself will maintain its merit for however long it needs to, because these programs aren't accredited and it's not quite sure if they will receive accreditation. And so a lot of students were feeling frustrated that they were putting a lot of effort into learning medicine, becoming nurses, whatever their program was, yet they still weren't able to guarantee that their degree would hold should any of the events change.
On the flip side, schools struggle to maintain experienced faculty in light of the challenges presented by the war. Those instructors that can teach often had to do so over the internet. Doctors specialized in their professions were asked to also be educators despite their lack of teaching experience. Many are even asked to teach outside their field of expertise. Residencies and other practical medical training were also limited due to shortages of qualified personnel to oversee learning. Hospitals and medical clinics have been infamously targeted throughout the conflict in Syria, and this translates to a shortage of safe, stable environments where medical workers can train.
There were various reasons why a doctor might be targeted, but largely it was from their presence in hospitals. And in fact, we even had residents share with us that, in their program, as they're getting trained in hospitals, they sometimes had to be moved to different hospitals because in the middle of their training, the hospital would get attacked. And so they couldn't continue in that hospital because it was no longer present. Or they would stay overnight at hospitals because they were at risk of traveling during maybe a late night rotation. They're at risk of getting attacked on their way back home or on their way to the hospital. So rather than expose themselves to that risk, they would just spend the night in the hospital.
Programs in opposition-led northwest Syria tried to adapt policies and practices to mitigate these many negative impacts. Some measures addressed mobility concerns by reducing required attendance rates or providing on-campus housing. Online courses, recorded lectures, and video conferencing software were also widely used resources. Despite the conflict and multitude of challenges, many Syrians continue to pursue medical training. Together with their teachers, these students are often proudly committed to help their communities in this time of crisis.
And to me, there's a lot of hope in that when people are willing to take the time it takes to study, work hard, and then in the process work to find ways to help their community so that they can alleviate the suffering that they're witnessing.